Afternoon, everyone, and thank you for coming. My name is Cecilia Lanata Briones. I'm the chair of the History of Statistics section here at the RSS. And before, the proper introduction, let me just give you some kind of housekeeping rules. There is no fire alarm that's meant to go off. So if it does go off, we're meant to leave very quickly the building. And we're meant to sort of exit and go through Errol Corner. There's a tree there. That's our meeting point. But there will be people here from the RSS that will escort us out so we can follow them. That said, again, thank you everyone for coming, but thank you more importantly to Lynn for, bearing with us. And we've had planned this meeting before the pandemic, if I'm correct. And we tried to reschedule it several times. So for us, for this section, and obviously I'm speaking on behalf of the RSS, it's a pleasure for us to have her here. She's gonna talk for around 40 minutes. And then I have this microphone that I will go around and kind of handing to you for the Q&A session. So that's sort of the plan. Let me very briefly introduce Lynn to you in case you don't know her. Lynn MacDonald did her PhD at the London School of Economics in Sociology and has mainly pursued an academic career teaching in Canada. She has also served as the president of the National Action Committee, then Canada's largest women's organization. She was a member of Parliament in the 1980s when she authored the Non-Smokers Health Act, the first legislation in the world to require smoke-free work in public places, subsequently taken up by the World Health Organization and even the UK. In her spare time, she is a climate change activist. She has published 28 books to date, 16 of them in the collected works of Florence Nightingale, 3 on social theory, exceptionally including women theorists. In recent years, she has taken to defending the falsely accused, that is, their reputations denounced statue removals and renamings. So here a warm welcome, with me give Lynn, that's what I'm trying to say, a very warm welcome.
Thank you very much, Cecilia. I'm delighted to be at the Royal Statistical Society. Of course, Florence Nightingale was the first woman fellow to be elected, and I'm going to talk about her statistics from then to now and try to give a fairly all-encompassing picture of what she actually did in statistics and how this changed over her own lifetime. So, in case you don't remember, a few basic facts about Nightingale. Came home from the Crimean War of 1854 to 56, major founder of nursing after that war, from the fame she got in it and the money that was given to her, raised in her honor, which she put into founding the first nursing school in the world. She was a social scientist, and that's how I got onto her, as I'm a sociologist, and I moved from doing contemporary quantitative research to doing more historical work, and I wanted to find the women who had written in social theory. As we know, that there were women composers who were neglected, women artists, and I thought there were probably women theorists as well, and I found them, and Nightingale was one of them. So I found her not as a nurse at all. I was aware of her nursing, and then of course I got especially interested in what she had to say about healthcare and the broader system within which nursing exists. Pioneer of evidence-based healthcare, and learning from the lessons of the Crimean War. And plenty of lessons to learn from that terrible war. She was practical and a visionary. I mean, she really covered the ground very well. She had these high goals, and she attracted people to work with her, and she worked on things right down to the finest details as well. Perhaps because she had seen such astounding results in reducing mortality and morbidity during the Crimean War, she could think boldly. She had seen it happen. The Crimean War had terribly high rates of disease and death. Sorry. It's not getting close.
It's just making a noise.
Oh, okay.
Yeah, if you put it close like that.
Okay.
Yeah.
Okay. Can people hear this better? Okay. Yeah. She worked with leading people, and leading people such as William Farr, Dr. John Sutherland, major public health expert. They were inspired to work with Nightingale. They had knowledge she did not have. She did not go to university. No woman went to university at that time, or even to a secondary school. And yet she had things that she could contribute, and they respected her. When you look at the correspondence both ways, you see how pleased they are to be working with her because she had so much to contribute. So she worked with leading statisticians and architects. For hospital reform, you need architects and engineers. You need accurate, relevant statistics. And you need officials who will bring in reforms and evaluate them along the way. She saw the process through from beginning to end very, very nicely. Her team, she always worked with top experts. Dr. John Sutherland headed the Sanitary Commission, and it arrived in March of 1855. This was after a change in government, the Lord Aberdeen government, which had sent out, which had declared war and sent out the troops and nurses, etc. He had been replaced by the Palmerston government after a motion of mismanagement of the war, and so that's when the improvements began. And it was Dr. Sutherland, a civilian doctor, Edinburgh trained a civilian doctor, not with the Army's medical department. Armies are used to high death rates. They don't get too upset about them. And Nightingale did. I mean, she thought it was terribly wrong, and obviously Dr. Sutherland did too. Robert Rollison was the number 2 person on it, a civil engineer, and then he became her water expert on all kinds of water issues, particularly in India. And Dr. John Sutherland, as I say, never worked as an officer, but he was a civilian employee of the Army Medical Department. And he spent quite a bit of time at her house. He would spend time there, and he would go over the material that came into her and draft replies for her. And they worked together very, very effectively. After the Crimean War, the object was to see what went wrong and what should be done differently. And that's what they started work on very soon after they got home from the war, August 1856. Lots of data became available through the Army Medical Department, but I'll discuss how they treated it differently from the Army Medical Department. My last book is on, this is the advertisement, my last book is on the work that Nightingale did with doctors. And this is it. Florence Nightingale and the medical men, they were all men who were doctors at that time. And later women did get into the medical profession, but they were not part of the Nightingale team that did this crucial work much earlier on. So you're probably familiar with these polar area charts. If you're not, if you look at the larger one on the right-hand side, it starts at 12 o'clock at the top and then goes around. And the wedges indicate deaths, and they're with either from wounds or from disease, preventable disease, or non-preventable disease. And Nightingale thought that weren't too many things that were non-preventable. The big blue wedges are preventable mortality, and you can see when you get down to the bottom of the right-hand graph how large they are, and that's from the terrible winter that the troops were not well treated. They did not have adequate supplies, winter supplies, really horrible treatment of the troops, and then the Supply Commission did something about that, but that took time. So you can see it swings around, and once you get to the left-hand side, then you can see a line over to the graph on the left, and you can see the wedges are very much smaller because the death rates have gone down. And they continue to go down. As you move up on that smaller one, you see those sections, they're very, very small. And so the Sanitary Commission got the death rates down, got rates of disease down, and they stayed down. There was a slight exception with an upsurge of cholera, but basically they made the changes that were really needed to save men's lives. Her confidential report After the war, well, she prepared an 853-page, it was not, technically it was not published, and she sent it to people saying, this is a confidential report. At that time, you know, she nearly died during the Crimean War, probably of brucellosis, and she was very ill after it. And I think she thought when she was doing this that she would not be around to keep protesting and to keep agitating for changes. And so she wanted to have solid documentation that people could take it up and work on it if she was no longer there to do it herself. And the polar area charts, Farr and his office did a lot of the preparation work. It's interesting to see the correspondence going back and forth. He had done charts before Nightingale, no doubt about that. He had had that experience, which Nightingale had not had. But when you look at what they produced together, it was better than anything he had done alone. So clearly there was a synergy there that they did very much better work. So her answers to written questions are the very brief answers that she gave in writing. She did not appear before the Royal Commission on the war, which was headed by Sidney Herbert. She did not appear there, and she realized that this was a bit unfair, that people couldn't cross-examine her, but it was unseemly for a woman to speak in public. And so she had to do written answers to questions, which she, in fact, devised herself, and then they got sent back to her to do. And some of them are quite long, and they have tables in them, and some are very short. To what do you owe the high death rates, or something like that, of the Crimean War? And the answer is 3 words: 2 sanitary defects. And so that you get quite a variety of answers to this in terms of the complexity of the material that she presented. Learning the lessons of the Crimean War, the Army Medical Department got it wrong. There's just simply no doubt about that. When you look at their extensive report, 2 volumes, and it had charts in it and lots of tables, and certainly Nightingale and Farr used their data. Nobody else would have had the data to use, but their analysis was just way, way, way out of line. Not their analysis. Sir John Hall was a principal medical officer, and his views were very different from Nightingale's and Farr's. And I'll show you what that Nightingale opposed his explanation. He emphasized climate as a cause of disease and death. And of course, that's a great cop-out. If climate is what is causing disease and death, and this would be a big issue in India, where of course it's very hot, and if you can just blame it on India, but no, it's not the climate, it's not the temperature, it's the sanitation and the ventilation and crowding and things like that. Nightingale certainly herself learned. Now, in the official report, Medical and Surgical History of the Army in the East, they don't call it the Crimean War, it's the Army in the East, because the Crimean War only got taken up as a name very much later. Well, you can see there's some information there. This is a chart. It gives you, it shows how this is the strength for the 3 major branches of the Army. Cavalry, artillery, and engineers, infantry. Again, you're getting some data here in a chart, and there's lots of material of that sort in the official report. And then you get on to the meteorological tables, and barometer, temperature, mean temperature, taken at different times of day, humidity, aspect of the sky. They're all these detailed charts, but they don't prove anything. They just bump along. And of course, death rates went up and then they went down, and absolutely nothing works to show that at all. And so Nightingale and Farr simply did not follow the official report of the Army Medical Department, prepared under Sir Andrew Smith, the director. Now, here is a chart I think is very interesting from the official report, And you can see it does what Nightingale's charts did not do. It distinguishes between different types of disease. The different colors represent different types. And you can see the largest blocks, that's the largest amount of mortality. You can see how it went up, and so you get these very large blobs. As you got the polar area chart, you can see where the death rates go up. And then towards the right, you see how they're much smaller segments as time goes on, because the death rates have gone down. Now, even here, the ones to the far right, in Nightingale's chart, you can see these tiny, tiny, tiny little segments on her charts. And here, however, what they did is they got so small that they combined them together so that they wouldn't disappear on the chart. But the whole point is that they did get so small, and it doesn't show up on this chart. And there's no indication here as to when the Sanitary Commission arrived and what difference it made in terms of the amount of mortality. Just is simply not there, because the Army Medical Department didn't want to acknowledge any contribution from either the Sanitary Commission or the Supply Commission, both of which were staffed by civilians, not officers of the Army Medical Department. So the official report, no acknowledgement of the effectiveness of either of those important commissions that arrived. Nightingale flagged the arrival in her charts, that's for sure, and you can see, and actually broke the two sections of the chart based on the arrival of the Sanitary Commission, because it was so important. Now, I think it's very interesting to compare the British and French armies' death rates. Now, this bar chart that I'm going to bring up is one that I did because the French data were not available when Nightingale was working on the subject and when Farr was working on it, and not for years later. The French only published their material long after the war, and Nightingale had gone on to other subjects. There's simply no doubt about that. And Farr had gone on to things like, organizing the census and doing things like that. So the British made these substantial changes thanks to the Sanitary and the Supply Commission. The Supply Commission improved conditions of life for the soldiers in the field. The Sanitary Commission was cleaning up the actual hospitals, which were terribly unsanitary. The toilets were plugged. It had to remove the dead horse from the water supply, had to move the bodies in the cemetery further away from the water supply. These just basic things that had to be done, and they were done by the Sanitary Commission. Then that was for the British Army. The French had nothing comparable to the Sanitary Commission or the Supply Commission. And so here you have it. The red is for the redcoats, and the blue is for the French. And you can see on the left the higher rates for the first year of the war. The British were not as well organized. The French were better organized. They had a land transport corps. They had cooks that went along. I mean, the British were giving men this just salt beef and salt pork and this hard biscuit, horrible stuff. And if you had scurvy and your mouth was in pain, not very good. The French brought along bakers. So they had their baguettes, I suppose, or whatever they had. They had decent bread. The British conditions were very much worse. In any event, the death rates were higher for the British in the first war, but you see how far they brought them down. Just that second segment is very, very small. Whereas for the French, their death rates went up in the second winter of the war, although there was no fighting. The Russians had walked out of Sebastopol in September of 1855, but it wasn't until March that the peace treaty was signed. And so the armies stayed there. They were basically on holiday. They didn't have to do very much. The Russians had walked out. They weren't anywhere around. And so that was a situation. But the French death rates went up even though there was no fighting, just from, I guess, they were tired from general conditions, and they had made no attempt to make improvements. You know, they had their system, and they stuck with the system that they had. Well, applying the lessons of the war, Nightingale's famous book, Notes on Nursing, What It Is and What It Is Not. I think that this somewhat suggests that you have to know what you don't want to do. And in the case of the Crimean War, you don't do things the way the Army Medical Department wanted them done. And the Notes on Nursing, What It Is and What It Is Not, is a positive take on what is needed to avoid high death rates. Now, Notes on Nursing was not came out quite independently of her nursing school started. It wasn't meant to be a training book at all, but it just gives general advice. Some of it is for people at home, some of it is for people who are actually sick. But the ironic title perhaps makes the point that you really need to understand what was done badly and really reject it and go on with a different point of view. The Crimean War, Nightingale and Farr rejected the entire analysis of the official report. Nightingale learned about unintended consequences from Quetelet, the Belgian statistician. She was a great fan of Quetelet's, and so she had a much more critical approach that unintended consequences, you do something that seems the right thing, but in fact you send the death rates rising. And Nightingale understood that you really had to be very firm on what is actually happening, not what might be happening, depending upon where you are. The book gives the positive lessons from the war, what went wrong, and how to prevent them in the future. So, overcrowding, poor ventilation. With the barrack hospital, the men, when they finally got beds at all, because the army didn't have beds for them, or bedding, or clean clothing, the men came in from, they had to cross the Black Sea. If you look at a map, the hospitals that the Turkish government gave the British were a long distance away from where the war was going on. And so they would arrive vermin infested, just their feet might be blackened from cold. I mean, they were just in horrible condition when they arrived, and at first there weren't even any beds. Well, Scutari is quite close to Constantinople, now Istanbul, and so you could buy these things, but the Army Medical Department, they were just so complacent about it. They had their winter supplies got lost in a ship that sank, and that had blankets and greatcoats and all kinds of things that would have helped the men get through the winter. It sank. Well, they had money to go and buy replacements, but they didn't do it. Nightingale had access to a fund that was raised through the Times newspaper, and she used it to purchase things that should have been there all along. So she got beds. Mind you, the men were only 18 inches apart in those beds. Now we're kind of aware of the 2-meter rule, thanks to COVID, you know, that you should keep that kind of distance. So it's still very, very crowded, and there isn't cross ventilation at all. Ventilation is terrible in the barrack, in what's called the barrack hospital. It was not a hospital under the Turks. It was a barrack that was given to the British to use as a hospital. Well, it was never set up to be a hospital, and it certainly worked very badly for it. So overcrowding, poor ventilation, warming, that had to be paid attention to. The bed and bedding, which Nightingale did by making purchases, lack of fresh air and sunlight. Nightingale quite early on got onto the need. It's not just fresh air that people need, they need actual sunlight. And there was a bit of a literature on the importance of sunlight in keeping people healthy and helping them to recover. So overall, sanitary defects, the disposal of bodily waste and water, these were very, very important. And Dr. Sutherland knew about those things because he had been medical officer of health in Liverpool, and Liverpool was the first British city to take these things seriously. And so he brought a staff with him of people who had worked in Liverpool, presumably, and knew what to do at Scutari. applying the lessons to hospitals. After Notes on Nursing came out in 1860, Nightingale then worked on getting a book out, Notes on Hospitals, in 1863. And she had published a long paper on it before 1859, so it wasn't her first take on it, but she got it out in book form in 1863, and she only had it printed once. It certainly went out of print, and she could have had it reprinted. Notes on Nursing did get reprinted, but Notes on Hospitals didn't, and I think she felt that when she was asked for advice on hospitals, she had to get to the latest material, and she didn't want things kind of embedded in a book when the data might show different things later. Sidney Herbert's Royal Commission report proposed similar reforms to what Nightingale had in her own book, Notes on Hospitals. And they, of course, worked together very closely for about 5 years. He died rather sadly very young, and so, but he had finished the Royal Commission report, and it had recommended that 4 sub-commissions be established, and Sidney Herbert chaired all 4 of them because he understood it's not just what's in the report. You have to have a strategy to apply it, to get the lessons out there. And so Sidney Herbert was very good on that, and so was Nightingale good on those things, that you have to not just do the report, you've got to line up your recommendations. And then Nightingale went on to say, and basically you have to have a media strategy. It wasn't called a media strategy, but you know what I mean, that as to how it's going to get into journals and magazines and have people comment on it. Because if you want something to be implemented, you have to have people on side to do that, not just have it buried in a report. He took on the task of implementation. They worked closely together for a number of years, and set up an Army Statistics Department. And there was an Army cooking school, and so they went away from just sending them off with this terrible salt pork and salt meat and this hard bread. They actually taught people to cook and to improve nutrition for the Army. Now, it's a bit of a black box here. We know that the death rates went down enormously, rates of disease and death went down. What actually did it? Well, many changes were made, so we don't really know which were the most significant ones. Nightingale contributed to that, but I would have to say it's far more what Sutherland did and what the Sir John McNeill did on the Supply Commission, that they were the ones who actually did the most to bring those death rates down. What did it? Well, no controlled experiment. Well, unless you say, well, the French didn't make any changes, they carried on, and the British did make changes, so you have a little bit of that. But Nightingale, and with the help likely from Sutherland, they came up with better alternatives, and they began to see some of the results of that. Evidence of death rates, the decrease was obvious, but did the hospital reforms work? We don't really know that. Data were published earlier to show that the rate of deaths per admissions in London teaching hospitals, you might say the best hospitals that you're going to find, they were 10% of admissions. And those data came out for a number of years at 10%. So then when Nightingale moved on, and Douglas Galton and a number of people moved on to doing hospitals differently, using the pavilion model. Do people know what the pavilion model is? Well, it's the pavilion model is you have long, fairly narrow wards, and you might have 30 people in it. And then you have windows on either side, so you get cross ventilation. And desirably, they would run north-south so that you would get sunlight coming in east and west for the whole of the day. So the pavilion hospitals, St. Thomas's was the top civilian one in London. You can't see it now because it was bombed in 1941, and 3 pavilions were left, but you probably wouldn't notice them. The Herbert Hospital in Woolwich, after Sidney Herbert died, Nightingale got the got the military hospital there named after him. If you ever have a chance to go to Woolwich, it's now, I think it's called the Royal Herbert Mansions or something, they're condos, because it's they're listed buildings, but you can see that there are pavilions, they're all lined up, and you need to have enough space between them so that sunlight can come in on both sides. And what you're doing is, with the pavilion method, you are reducing the number of people who are exposed to each other's germs. This is pre-germ theory. People didn't know exactly what was doing it, but Nightingale certainly understood you don't want to have hundreds of people in basically the same room. You want to keep the numbers down. And that's why she liked hut hospitals, because a hut with the next hut some distance away from it, then you have less cross-infection. So did pavilion hospitals actually reduce the death rates? We don't know, because hospitals stopped reporting data. Nightingale wanted to get them to report data on a uniform basis so comparisons could be made, but that did not happen. She worked on this with the National Association for the Promotion of Social Science, but it didn't happen, and so when they stopped publishing, we just don't know if those other designs, the pavilion method, certainly sounds persuasive when you hear about it, but did it actually make a difference? We simply do not know. Ooh, just a sec. The Army Statistics Department. This was a new department set up, one of the subcommissions that Sidney Herbert had recommended, and as Nightingale said, it should provide timely data on deaths, epidemics, and so on. It's got to be timely so that you can step in and make changes. I mean, the Army was very good at collecting data slowly and after the fact, but not in time to make any actual difference. Weekly reports available to the commander, who should know how many men he could put into the field at any time. You've got to have timely data that you can act on. Statistics must be timely to be effective and to be usable. Better hospital data also on nurses. Nurses and doctors died in hospitals too, not just patients, but they died too. And Nightingale was very keen, if you're going to encourage women to become nurses and to take training in a hospital, you don't want to be sending them to their deaths. And so, and deaths indeed get recorded from time to time. And so that was something Nightingale wanted to know about hospital deaths of patients and of nurses, presumably also of doctors, but I note it particularly for nurses. Nurses' deaths are noted in notes on hospitals. Certainly she paid attention to it there, and she urged that hospitals track data on nurse deaths as well as on patient deaths. The need for good population data. Nightingale was very keen that the census collect more usable information. And she tried to get questions on housing and sickness in the 1861 census. Now, Farr was basically in charge of the census, and she talked about it with other people, cabinet ministers and so forth, but she didn't get that to happen. It just didn't. Housing is a social determinant of health, is certainly very widely recognized. The need for more detailed population data. We should have a return of the whole sick and diseases in the United Kingdom for one spring day. Well, the census is taken in April, so it's not the coldest, it's not the hottest time of the year. And this would give an idea of the sanitary state of all classes of the population, because if you collect data on occupations, you can look at what are deaths like, at different levels of jobs and income and so forth. So she recommended something that would have been very helpful and did not get it. Nightingale didn't always get the things that she wanted. Nightingale learned from the examples of Cadley on this and the high rates of death in foundling hospitals. Foundling hospitals were set up so that a woman, a girl with an unwanted baby could push it through a little door, a little door that the baby would be looked after. So you might say that these were institutions with a benevolent purpose, but they had very high death rates. And Nightingale was always, you have to go by what actually happens. Deaths from medical errors. Different treatments have but a small influence on the death rate. It's more about the actual physical state of the hospital, the amount of ventilation and crowding and those global figures, rather than what treatment did they get, what medicine was actually used. Medicine was very, very backward at that time. There were very few medicines that actually worked. And of course, things like bloodletting and blistering were still very common. So unintended consequences. Administration saves more hospital patients than the best medical science. This is on Nightingale, and she got this from Cateley. Bloodletting and blistering, they carried on for decades and decades. No evidence that they did any good. And I guess nobody tried to show that they didn't do any good, but it's just that these things, they got accepted. It's very hard to get changes made. And so you have the wrong things going on for a very, very long time. Cholera belts. Cholera belts were considered an important thing for soldiers going to India, going where it's hot and where you sweat. And so the cholera belt it was called a cholera belt. It would be cotton and would be wound around the person's waist, and no doubt it gave some relief because it would not be dripping the sweat. But did it do any good? Well, eventually it was agreed that they didn't do any good. But yet, this was one of the things that had to be provided. And the other thing that happened is doctors would just step up the ingredients of their cures: mercury, lead, arsenic, bismuth. It's just terrifying when you read of what went into medicines. Indigenous death rates. This is something which is an issue in Canada, and Nightingale did the first quantitative study about the influence of what were called colonial schools and hospitals, and the disappearance of Aboriginal races in Australia and New Zealand. Nightingale undertook a study of these institutions. She devised a questionnaire, and it was sent out by the Colonial Office. Now, the cabinet minister in charge was actually the Duke of Newcastle. The Duke of Newcastle had been the senior war minister. Sidney Herbert was the junior war minister. So this senior war minister is obviously pro-Nightingale because she was good news when the war was going badly. The fact that there were nurses there led by Nightingale made the British Army and their medical staff look very much better. Nightingale did the analysis, and she sent a paper to the National Association for the Promotion of Social Science on death rates in these schools. 13 of them are in what is now Ontario, and she found that roughly overall, you have Africa, South Africa, and Australia, Ceylon, and so forth, that overall you had rates twice that of English children living at home. They were a little bit less than that in the case of Canada. And so she gets this material out. It was very hard to collect the data, and she wasn't very happy with it, but it did come in, and she did get a report out. And then, of course, recommended, and she was supported in this by the National Association for the Promotion of Social Science in the department following up on those results to see, did they continue? Well, they didn't follow up. The Duke of Newcastle moved on to something else, and it just nothing more came of it. So it's just one point in time, and you try to do something, but whoever is in charge just won't continue to do it. Excessive Indigenous deaths. The data were inadequate, but they did show that they were too high. If you have a high standard, that is, English children living at home, the best, because even like English boys at an elite public school, a boarding school, they would have higher rates of death than if they were at home. And men in barracks, And after all, you have to pass a physical to get into the army. But so men in barracks, they had higher death rates than they should have, just because of this kind of crowding. So Nightingale wanted the Colonial Office to continue to monitor it. This did not happen. Collection of data for the Poor Law. The first woman appointed to be at the civil service serious level was Jane Senior, and she was an inspector of poor law institutions. Nightingale drafted a questionnaire for her, in effect, to be able to consider how good the results were from these different institutions. And it's a good questionnaire. She devised it for Jane Senior. Sadly, Jane Senior did not last long on the job. She fell ill and died and wasn't replaced by another woman, and things went on just to be run the same way they were. But Nightingale hoped that by doing research on how the different workhouses did, you could find out if some worked better than others, and then you could apply that to making changes in the workhouse institutions that were not as good. So this questionnaire was never actually used. It's written up, it's not there. Evidence-based social policy. Nightingale is acknowledged as a pioneer of evidence-based healthcare, and this is related to a concept of social physics, physique sociale, of Quetelet, that you have solid information on your population. Nightingale wanted social physics to be taught at Oxford University. Why Oxford? Well, because that was the university that trained the most politicians, members of parliament, cabinet ministers, and the most officials, the top bureaucrats in various departments, more so than any other institution. And so she wanted them to have a good sense of methodology so that they could commission research and would be able to evaluate it and use the results. Her last great initiative in the 1890s, when she's basically starting to retire, and so she tried to get this going, but she did not succeed. Evidence-based social policy, she looked to Francis Galton, and there's correspondence with them, that he would take it on at Oxford, but he flubbed it. He did not get it. He did not get it going. He did not see its importance. What he writes to her is just really very badly missing the point. And Carl Pearson writes about this in his life and letters, and so we can see what Nightingale was trying to get at, but it didn't happen. Data are collected and they're not used. Well, I guess I'm not surprising anybody by saying this. We all know that it happens, that somebody decides to get the data, but how to ensure that they actually get used. Nightingale's case, the enormous amount of statistics that is available at their disposal, this is senior bureaucrats, or in their pigeonholes, which means that not being at their disposal. We do not seek an arithmetical sum, she said. We want to know what we are doing in things which must be tested by results. Very obvious, right? Very obvious. But in fact, this was really not being done. I mean, statistics would be collected, they'd get published, and nothing happened with them. Nobody was in charge of doing anything with them. Nightingale's examples, the results of compulsory elementary education. Compulsory elementary education came in with Forster's Education Act of 1870, and what happened? I mean, what good did it do? Well, that's a very reasonable question to ask, but it was not pursued in terms of data collection. The effect of the poor law on crime, or do children who go into workhouses, poor law houses, what happens to them? Do they commit crimes, or do they get the assistance they need to lead a better life? Workhouse inmates, do they become inmates themselves? The effect of British administration in India, the British government took over from the East India Company in 1857, did it make the people richer or poorer? Their trade and handicrafts flourishing or perishing? Very good questions. That what's the actual effect on people's lives? And Nightingale wrote that up as one of the things that she wanted to have data collected on, and it simply did not happen. Well, I'm running to the end, I think, pretty soon. And yes, okay, oh yes, indeed. That I did want to say something about greenhouse gas emissions. Our big issue nowadays is climate change and global warming. And Nightingale liked to work on the big issues. If she were around, she would be wanting to work on this. So I did this chart, and the radius is of per capita emissions, greenhouse gas emissions, and the whole wedge is of total emissions. So you can see the red, that quite large red blob is China, and then you can see at the top the blue one is the United States, and Canada is only roughly 10%, but you can see the Canadian rates are very high per capita, and the US ones. So it's just a way of presenting data that are important, that people might be able to think about it. Well, that was some time ago, and so I got some more recent data, and this is the 2021 on the right-hand side, and you can see the China section has gotten very much larger as China has industrialized and so forth. And then I just had some lines printed out to show what, in the case of the US, you actually have some declines. They did bring in some measures, and then if you look at the red one, is for China. It's a slight increase over time when other places are going down, and Europe and so forth. I just point this out as looking at data and looking at pictures of it can be very helpful. Well, I just want to close on this one. Nightingale's tribute to Sidney Herbert. He was the war minister, the first minister, she said, to aim at reducing death rates and to find out how to do it. And he worked on this very assiduously. He chaired the Royal Commission after the war. He chaired the 4 subcommissions after the war, and established an Army Statistics Department. He did all of those things. And we can also see, and he was supportive on things in hospital reform and so forth. Now, if you look at this is Nightingale's tribute to Sidney Herbert after he died. He died all too young. But if you look at the middle bars and the bottom ones, the middle one, which is the largest one, this is how Lord Herbert found the army. This is what death rates were like when he took over. And then the bottom one, you see how much smaller they are. This is how Lord Herbert left the army. He's really brought those death rates down. Now, I can't think, I don't know if you can think of anyone you could say anything equivalent to, that their tenure of office made changes of that extent. It's really quite remarkable. And so I think it's also fitting that Nightingale, she gives this tribute to her friend, Sidney Herbert, and she does it in a chart, because charts are good and they help us to understand things very well. So that's where I want to leave it with you. I'll tell you these little jokes if there's a bit of time later, but I'll leave you with this one. It's Florence Nightingale at the Royal Glasgow Infirmary, and that's, oops, just a sec, what's happened here? And Lister. Lister made, of course, these great breakthroughs in antiseptic surgery, and I like to see them together. They're side by side in the front hall at the Royal Glasgow Infirmary. They both saved lives. They did it differently, but they both did. So over to you for questions.
Turn this on. You bear with me that I'm turning the mic on. There we go. Does anyone have any questions?
just to kick off, thank you very much. It was very interesting. One of the most interesting things to me was the absence of any mention of the Royal Statistical Society. Which year was she elected as a fellow, and did the society engage in the Crimean War statistics or with her work in any way?
I'm sorry, I didn't get what the question is. I think it was Farr who nominated her, but I didn't get...
Well, first of all, which year was she elected a fellow of the RSS? Do you know?
I don't know that she did anything about it, because by the time she was... But by the time that happened and she was named a fellow, she wanted to get things done. So she was working on this project, then she went on to the next one. And so she would never have attended a meeting. For one thing, she wasn't well enough to attend meetings. She nearly died during the Crimean War, and then was very ill after it. And she, when you look at the correspondence, she says, I'm sometimes a prisoner to my room, sometimes a prisoner to my bed, and sometimes she can go out. So what she could do was very limited. There were people who came to her, and that was mainly Dr. Sutherland. But and Farr had to somewhat tell her that she had to accept the honor, that Nightingale did not... I think she thought she was working for God, and you really didn't look for what honors you would get or what pay you would get or anything of that sort. So she was always very reluctant to be honored for anything like a medal, or the Queen Victoria gave her a fancy jewel brooch and so forth. And this is just not important for Nightingale. She's on to saving more lives.
Thank you, Lynn. That was really interesting. I'm really interested in the relationship between Farr and Nightingale. So as far as I know, and correct me if I'm wrong, but as far as I know, Sidney Herbert asked Nightingale to produce a pamphlet of diagrams, or to publicise a pamphlet of diagrams that went alongside the report on the Crimean. And I thought that those diagrams were Nightingale's, but actually when I've looked recently, it's Farr's name on that pamphlet, and I just wondered whether you knew how much those diagrams were Nightingale's, or what was the influence of Farr was.
Yeah, that's a very difficult question. There is correspondence both ways, and Farr adored her, and they were just wonderful asides, and he quotes classical figures and so forth. It's really a very warm association, but it's just not clear. Clearly, he and his assistants actually pulled the data out. Now, to what extent did they draw the conclusions from it? And so you have Nightingale's constantly sending them thanks and a brace of pheasants, to compliment them on, because you can't pay somebody like Farr, so you send them a gift. And so that they did have this very warm association, but it's just hard to say. R.J. Andrews, an American, put out a very interesting book just a couple of years ago, and he spent time looking at the batwing charts and those really weird ones. I looked at them years ago. I couldn't make sense of the batwing charts, and I don't know how much sense R.J. did on that. But it's a very relevant question, and there's no clear answer to it. I think it was a combination of things, and that Farr would send stuff to Nightingale and say, dear Miss Nightingale, here is the last of our calculations for you. Had she decided what to ask them for, or had they decided? Don't know.
Thank you.
So can I just add a bit to Lynn's reply about Nightingale's involvement with the RSS? As Lynn said, she wasn't able to go out to meetings, but there was only one class of membership at the time, and probably if it was today, she would be made a a distinguished honorary member or one of the other classes of membership. And this is something that the statistics section looked into. There's no evidence that she ever went to a meeting or engaged with the Statistical Society, which it was at that time. And in the next generation, there were women who did engage, such as Clara Collett, who was on council and was very active. That it was something that was, that the people who nominated her were the people who were the members of council at the time, and of course they were people, as Lynn said, who knew her and valued her work, but they weren't expecting her to become active.
I think she interacted indirectly with the Royal Statistical Society through members or fellows of the society. So there was Farr, of course, and another one up there was Thomas Graham Balfour, who was the first head of the statistics department or branch. And they were very close. Of course, I mean, he was the secretary to the Herbert Commission, and she was instrumental in getting him onto that as secretary. So I think she did interact indirectly. She was actually elected as a fellow in 1858. So that's post-Crimea, of course.
From then to now. And so this is up to now. What about next year? What are we going to find out? Now, it happens that if you sell important manuscripts out of the country, you have to deposit a copy at the British Library. And Nightingale's letters to Ada Lovelace, daughter of Lord Byron, and colleague of Charles Babbage, they were deposited in 2018, but with the full 7-year embargo. So as of the 17th of August next year, we may see something more along this line. We just don't know what's in those letters. So there could be further developments.
2 last questions, if we have time.
Thank you very much, Lynn. I'm just wondering, having visited recently the extraordinary Temple of Effluent, known as the Crossness Sewage Pumping Station, built about 1860, I think, is there a connection between what Nightingale was doing and looking at sanitation and so on, and Sir Joseph Bazalgette's work?
I'm sorry, the connection between what Nightingale was doing and what on sanitation?
Yeah.
Nightingale certainly continued to attend to those issues and to be supportive of people who were doing those things. I don't think she was doing any analysis herself, but she understood the importance of it, that in terms of water and the need to continue to collect data to check out what's happening. But I can't be more, more detailed in comments on it, but it comes up, but it's not a concerted kind of analysis that she did later.
Thank you very much for your talk. When you were giving your talk, I kept thinking of Marie Curie and the impact that she had, or the effect that she had during the First World War on mortality rates with her mobile X-ray machines. I know she was a lot younger than Nightingale, and of course, X-rays are very different to sanitation. But I just wondered if there was any evidence of them having had any contact with each other, or Curie being inspired by her in some way.
Not that I know of, and I'm not quite sure what the day. I think that would have been too late. for Nightingale to have had any involvement on that.
That takes us to 6 o'clock, unless there's someone else that has a question. Very short one.
Just a comment. The nomination form for Nightingale, which is downstairs in the archives, they had to certify that he is a fit person, because the form only allowed for males.
On that very optimistic note, I think we can give a huge round of applause to Lynn.